Hi, this is Dana Henry, and for this discussion, I chose the case study Walking the Tightrope. For those of you that didn't read this case study, this is the case of an 85-year-old widow that's been in a long-term care facility for 6 months. She was admitted with severe osteoarthritic and osteoporotic pain. Her family initiated placement because she was over-medicating herself at home, confusing her medications, and not eating adequately. And the family and physician are reluctant to give her stronger pain medications because they don't want her to be doped up like she was at home. So instead, she's been given Tylenol every 4 hours for pain, which doesn't adequately control it, and it also places her at risk for liver and kidney toxicity. She's in too much pain to walk, and she's uncomfortable even just sitting in the wheelchair, so much that she's requested to be on bed rest with frequent repositioning. So she has a son who they say calls and tries to visit her once a week, and he's asked the doctor to make her comfortable, but not to give her whatever medication she received 6 months ago that made her drool and unable to sit up and eat. And then she also has a daughter that lives out of town who calls weekly and has also called the state regulatory agency to complain that the staff is neglecting her mother and not taking care of her pain. So the doctor in this case agreed to try Nalfon. It's an NSAID, and 2 weeks later the patient was hospitalized for a severe gastric bleed. So the first thing I wanted to discuss is autonomy in this situation. And autonomy refers to independence in one's thoughts or actions. It's the capacity of a rational individual to make an informed decision that's uncoerced. And to me, it doesn't appear that this patient's autonomy is being respected in the decision-making process. And it's clear that her pain is pretty severe to the point that her quality of life is being impacted, as well as her independence. And to respect her autonomy, I think that would mean to involve her in a meeting with her family to develop a treatment plan that's acceptable to her and that considers what her wants and needs are, while also ensuring safety. So this would ensure that the patient's preferences, values, and needs are considered and could serve as a complement to the physician's assessment of the patient. If the woman were no longer to be of sound mind or able to participate in the decision-making process, a family meeting would need to be held. And family meetings facilitate communication between healthcare providers and families of patients. And effective communication is really important, and it's been shown to improve the family satisfaction, the clinical decision-making, and the psychological well-being of the family members. So the second thing to discuss is the policies, is if the policies of this facility are meeting the standards set by the regulators. And it appears the pain treatment policies in this facility are not meeting all standards set by the regulators. The pain management standards require that patients in a facility like the one this woman is in, that they be asked about pain, which she has been. The organization's response to pain is also based on the services it provides. So in addition to that, if screening indicates that pain is present, the organization may assess and treat the pain. They may also assess the pain and refer the patient for treatment elsewhere or refer the patient for further assessment. So effective January 1st of 2015, for facilities such as the one we're discussing, the Joint Commission's Provision of Care, Treatment and Services Standard, that's PC 010207, states that the identification and management of pain is an important component of patient-centered care, and patients can expect that their healthcare providers will involve them in their assessment and management of pain. Both pharmacologic and non-pharmacologic strategies have a role in the management of pain, and some of the non-pharmacologic listed by the Joint Commission are physical modalities like acupuncture, chiropractic therapy, osteopathic manipulative treatment, massage therapy, and physical therapy, additionally relaxation therapy and cognitive behavioral therapy. And the pharmacologic strategies listed include non-opioid, opioid, and adjuvant analgesics. So it sounds like to me that the facility could be doing a better job and be doing more to meet the standards set by the regulators. Thirdly, I'd like to discuss the nurse's moral responsibility for advocating for this patient. The nurses involved in the care of this patient do have a moral responsibility to be more assertive in advocating for the patient's relief from pain. Inadequate pain control is a significant issue when you're caring for older adults, and that population is especially vulnerable for having their pain seriously underaddressed and inadequately treated. Nurses do have an ethical obligation to appropriately treat a patient's pain, and to fulfill this obligation, the nurses often need to advocate on the patient's behalf. Advocacy for the patient is addressed by the nursing profession in the Code of Ethics, and the ANA's Code of Ethics for Nurses with Interpretive Statement states that the nurse promotes, advocates for, and strives to protect the health, safety, and rights of the patient. Patients have a right to pain relief. Finally, I'd like to discuss the ethical principle of beneficence. And beneficence can function as a basis for good pain management, and it's also integral to the nursing profession's mission to alleviate pain and suffering. The three principles of beneficence serve as a framework for pain management, and according to Beauchamp and Childress, beneficence can be conceptualized as three principles. One ought to prevent harm or pain, one ought to remove harm or pain, and one ought to do or promote good or pain relief. Given the doctor is likely to see the resident only every 2 months or so in this type of facility, he should communicate often with the nurses caring for the patient to assess and monitor the patient's pain effectively, and to monitor the effectiveness of the treatment that's been prescribed. I look forward to your feedback. Thank you very much.